Myself Malamdi Mano from second year Bachelor's of Physiotherapy. Today we're gonna discuss on topic anemia based on pathology. Here I will label definition, introduction, symptoms, etiology and pathophysiology of anemia. Let us move towards the introduction. Anemia is a major killer in India. It states that India is majorly affected by anemia. The second point, statistic reveals that every second woman in India is anemic. It means anemia is more dominant in females than males. This point refers that. So that was for the introduction. Now let's move towards the definition. In simple terms, lack of blood means anemia, but anemia is a hematologic condition in which there is quantitative deficiency of circulating hemoglobin. And according to WHO, World Health Organization, anemia in adult has hemoglobin level less than 13 gram per deciliter for males and less than 12 gram per deciliter for females. So that's all for the definition. Now let us move towards the etiology. Etiology means basically causes. So let us see the causes. The first main cause would be reduce in counts of hemoglobin. Then there would be increase in loss of hemoglobin. There would be excessive bleeding. Then because of menstrual bleeding, genetic factors, nutrition deficiency like iodine, that is mentioned at last, iodine deficiency, which is a component of hemoglobin. Now these were the causes. Now let us discuss types of anemia. So there are basically four types: hemorrhagic anemia, hemolytic anemia, sickle cell anemia and aplastic anemia. So first, hemorrhagic anemia. It is due to excessive loss of RBC through bleeding, stomach ulcers, menstruation. Then hemolytic anemia. RBC plasma membrane ruptures may due to cause of parasites, toxins and antibodies. Due to rupturation of plasma membrane, hemolytic anemia will occur. In sickle cell anemia, in this condition, it is kind of a genetic condition, abnormal genetic condition in which there will be abnormal shape of RBC. The proper shape of RBC is biconcave, but here it becomes sickle cell. So due to the abnormal shape of RBC, which is congenital, it is called sickle cell anemia. Then aplastic anemia. There would be destruction of red bone marrow. The red bone marrow is responsible for synthesis of RBC. So there would be destruction of red bone marrow. It can be caused by toxins or gamma radiation, and this will lead to aplastic anemia. It is the major cause for the anemia. These were the types. Now let us discuss about the symptoms of anemia. What are the symptoms of anemia? So it will affect our central nervous system by making it fatigue. There would be dizziness, memory problem. There will be muscular weakness, and it will cause in respiratory system, it will cause shortness of breathing, and it will also affect our intestine. Due to affection of our intestine, there will be abnormal stool color, and then there would be hair loss, the yellowish eyes, and it will also affect our cardiac system by chest pain, irregular heartbeat. There will be pale skin, and it will enlarge our spleen. Spleen is also known as graveyard of RBC. Due to this anemia, there will be enlargement of skin or inflammation of skin. So these were the symptoms of anemia. Now we will discuss the pathophysiology of anemia. First of all, to know the pathophysiology of any disease, you should know the physiology, the normal function of our body. So let me explain you. Here the white structure you can see, it is bone. If we dissect bone from middle, there would be a center spongy part which would be bone marrow. Bone marrow is responsible for synthesis of every cell, and it also includes every cells, means every blood cells, is also includes RBCs. For the synthesis of RBC, bone marrow is responsible. But how it is instructed? It is instructed by kidney. Kidney will send instruction to bone marrow that they have to synthesize RBC. But how? There would be a chemical known as erythropoietin. erythropoietin will lead to erythropoiesis. They will instruct bone marrow to synthesize RBC due to erythropoietin. Then there would be erythropoiesis. In bone marrow there would be hemopoietic stem cells which will synthesize RBC. First of all they will synthesize some immature RBCs that are known as erythroblast. Erythroblast would be having some genetic material inside it which will synthesize erythrocytes, and this erythrocyte has no nucleus, no DNA, no cell organelles like mitochondria, anything, but they would be having hemoglobin, and hemoglobin has some components like iodine and everything. Basically hemoglobin is a protein which binds oxygen, and it helps oxygen to transfer in our body, so hemoglobin is very important. This was the normal physiology. Now what happens after anemia? When anemia is caused, that would be the pathophysiology. Let us discuss. And in anemia there would be lack of RBC. So there would be lack of RBC? It can be in two ways. First, due to the underproduction or to the destruction of RBC. It can be by two ways. So if we see the underproduction, what will happen in underproduction? There would be not sufficient RBC production. So how it will occur? If your kidney would be affected, there will be no secretion of erythropoietin. No secretion of erythropoietin, no instruction to bone marrow, and there won't be any synthesis of RBC. This would be the first reason for underproduction. And if there won't be synthesis of erythroblast, or if there would be any affection in bone marrow, it can lead to this. And if any component like iodine would be lack in hemoglobin, it is the one of the component of hemoglobin. If there would be lack of iodine, hemoglobin won't be synthesis, and it can also lead to anemia. So this all are considered in underproduction. Now let us discuss the destruction. In destruction, due to any pathological cause, due to any toxins or bacteria, if there would be any lesion of blood vessel, there would be hemorrhage, and due to hemorrhage there would be excessive loss of blood. There would be excessive loss of blood, and due to excessive loss of blood there would be anemia. It is one kind of destructive anemia. And if there would be in menstruation there is also blood loss, it can also lead to destructive anemia. So this was all about anemia. Thank you for watching my video.